Hello. In this podcast of aesthetic breast surgery, this is the second podcast. We're going to be talking about breast reduction surgery. And we're going to be discussing a series of questions which our patients pose to us, plastic surgeons. And the first question is, it's about breast reduction and a patient wanting to have an insurance cover for a breast reduction surgery. Now the question is, I'm a 43-year-old lady and I've been wanting a breast reduction since I was a teenager. They're very dense, they feel heavy and sore. So obviously she's discussing all her issues with the heavy breasts and she's wanting to know whether insurance covers a breast reduction surgery. Unfortunately, in our country, in India, the insurance doesn't cover breast reduction surgery until unless there are multiple lumps inside the breast, and these possibly could be covered in insurance. But otherwise, breast reduction surgery is viewed still as a cosmetic surgery procedure in India, and it has to be a cash based procedure, and it doesn't cover under insurance in India. So it's still I think in the West it's still done under insurance, but in India it's a cash based procedure. The second question that we have is, can I have fullness in the superior breast area with breast reduction and no internal bra, or will I bottom out again? Now the question posed is, I'm recently heard about the internal bra option for the breast reduction, and my first one was, she underwent a surgery 17 years ago, and at that time she was pretty dense, and a few doctors I've met use it. Is it crucial for a perk? Thanks. So this is her question about achieving a fullness in the breast area. Now, in breast reduction surgery, although it is a reduction surgery, we help in maintaining the fullness and we help in maintaining it that way, and we prevent any bottoming out by using an internal bra procedure, or in my practice, for all my patients, I use what is called as a dermal flap, the patient's own tissue, and I tuck it like a hammock, and this helps in preventing the bottoming out. And we have seen that this particular tissue, the dense tissue, is actually a support, and it helps in maintaining the lower pole, giving it strength, and thereby preventing any bottoming out or causing looseness of any fullness in the upper pole, and thereby preventing any distortion and further deformities. So yes, use a dermal flap for actually preventing any bottoming out issues. Now, the third question is also about insurance, and again, I told you that in India we don't cover breast reduction surgeries under insurance. Then the fourth, all these questions are about insurance, and the other question is 1,444 grams of breast tissue removed from each breast. Is that too much? So now this is a part of a major breast reduction. So you must understand that the categorization of breast reduction is based on the volume removed or the volume expected to be removed. So anything which is less than 500 grams is considered to be a small volume reduction. Anything which is 500 to 1000 grams is a moderate reduction, and beyond 1000 grams or a kilo on each side is considered to be a major reduction. So yes, I mean 1,444 grams falls under a major breast reduction, and it requires significant liposuction. It also requires a lot of contouring of the breast, suturing the pillars, giving it a nice shape, and restoring the structure of the breast. Now, the next question is there any way to tell if my plastic surgeon preserved the milk ducts during my inverted T reduction? Now, feeding used to be a problem way back 2 decades ago, when we did not exactly know how much of breast tissue to be retained. But now it is very clear that as a plastic surgeon, I leave around 4 centimeters of tissue under the nippleareal complex. So when I'm actually doing my flap surgery, I ensure that I preserve 4 centimeters of tissue behind below the nipple areolar complex, and this ensures adequate lactiferous duct. So you can ask your surgeon what is the thickness you've preserved, and usually the 4 centimeters will have enough for ducts. And I've had a lot of my patients call me up after conceiving, after they're wanting to lactate, and they have mentioned to me that they were able to significantly breastfeed. So this is a good thing, that if you leave significant amount of breast tissue under the nipple areolar complex, the chances of breastfeeding is much higher. Let's now move on to breast lift, which is again a very common topic with our patients. And so here we're going to discuss these questions. Now, a patient wants to know what are the types of breast lifts which are there, and what do the scars look like. So typically there are 3 types of sagging. You have 3 grades of breast sagging, and each of these have separate treatments. Now if you are having a very small sagging, the treatment is by doing a breast augmentation. And breast augmentation, usually there are no scars. Only the scar which is actually there is on the underside of the breast in the crease line, and that's the only scar which you may have. Some surgeons also prefer to do a periareolar augmentation of the breast, and that may be the approach in some surgeons. So when you're doing a breast augmentation to correct a mild breast sag, it's usually the breast augmentation is the preferred method. Now, there is also called as Benelli's mastopexy, where it is done for a moderate breast reduction, where you have a crescent shaped tissue or skin which is removed, and you may have a scar all around the areola, and this may be actually combined with an implant. And this is the second type of surgery, where you may have scarring all around the areola, and the implant is put through the same incision. In severe cases of breast sagging, you may have a vertical incision also in addition to the circumareolar incision. So it's called a lollipop incision, the circumareolar incision, and the vertical incision in severe sagging of the breasts. Now, moving on to the second question: how does a breast lift work? Now, breast lift is typically seen in post pregnancy states, and in patients who actually had a massive weight loss. So what exactly is done in a breast lift? We help in restoring the volume, we help in actually lifting the nipple areolar complex to a higher level, and we also improve the shape of the breast. So 3 things go into a breast lift surgery. Now, we are now going to be talking about questions related to breast implants, and the first question which our patient has asked regarding the implants is, she wants to have implants and lifts with fibrocystic disease. The question is whether she can have an implant with fibrocystic disease. Now, you must understand that fibrocystic disease is present in 25% of our women population, and it's a very common problem, and it happens because of the cyclical variation with the menstrual cycles, and patients may have nodularity, patients may have significant pain. Of course, I mean, once the diagnosis of fibrocystic disease is made with an ultrasound, the patient must consult her breast surgeon or the plastic surgeon, whoever she is involved with, and get that aspect treated first, because you cannot do a breast implant in a painful breast. So first, the fibrocystic disease has to be controlled, the pain has to be got down, and it's a cyclical variation, so obviously it is going to reduce in intensity, and then once she has a phase of a painless period, breast implants may be considered, and the augmentation of the breast can be done. Now, okay, the next question is breast implants with fibroadenomas. So this is a significant condition in a female breast. Now, anything which is a large suspicious growth, first thing is a malignancy has to be ruled out, and a scan has to be done to ascertain the diagnosis, preferably even a mammogram done to rule out any cancerous kind of condition in the breast. Now, once it is diagnosed that the fibroadenoma is there, you cannot leave fibroadenomas because the fibroadenomas actually grow in size and you cannot have an implant sitting below the breast. So it is imperative that the diagnosis of fibroadenoma is made and removed, and then a breast implant inserted into the woman's breast, and this should not be a problem once the fibroadenoma is removed. Often what I do in my patients is, through the same inframammary fold, I tend to remove the fibroadenoma if it's in the lower quadrant of the breast. Sometimes the fibroadenomas may be sitting in the outer quadrants, maybe sitting in the upper quadrants. Maybe a separate incision has to be made, a concealing incision in the areolar region, and this can be used to remove the implants, to put in the implant. Sorry. And now breast lift after implant removal, small A cup breast. Somebody is wanting to know what happens after removing the implants. Yes, the implants after removing, the breast is going to be looking deflated, and one may have to resort to some kind of a lift kind of a procedure. It could be a crescentric mastopexy, or it could even be a vertical mastopexy, depending on the grading of the breast ptosis. The other question which the patient wants to know is whether a breast lift revision with or without implants is done. So here's the thing: when the patients are wanting a implant exchange, they may actually opt for a bigger implant or a smaller implant, depending on what they feel with the present breast condition. Now, a lot of patients actually want to oversize the implants because they feel that the breast looks now smaller, and they want to have probably a slightly bigger implant. That's absolutely feasible. Some patients may also want to get the implants removed for medical purposes. They do not want to have the implants, and it is all right that they may have the implants removed and probably want a sagging correction at a later date. The sagging can also be corrected at the same instance. A lot of patients prefer that the sagging be corrected by one of the mastopexy techniques, and they also can have fat grafting into the breast to actually correct some of the volume changes in the breast. Now, implants after an explant. A patient wants to know, can she get an implant after having the implant removed? And the question is, I was originally a 32A and I got a 400cc high profile implant, got an elegant silicone implant under the muzzle at the age of 25, and now she is 32, and she had the implant, she had the explant and the capsulectomy at that time, and now she's healed well and she's had a perfectly great result. And now she wants to know that she can have a second breast augmentation, and she wants to know what are the options. Yes, of course, you can go in for, you waited for a significant amount of time, so this patient can actually go for the breast implant, and the preferred approach would be to go for the implant which is being planned, and preferably under the muscle. And implants choice can actually depend on the surgeon's preference, and depends on the patient's preference, and any company should be all right for placing these implants.